Hello, good morning. My name is Monica. Today I will discussing the subcutaneous routes of drug administer. One of the most commonly used parenteral routes in pharmacology. The subcutaneous route involves the administration of drug into the subcutaneous tissue, also known as the hypodermis, which lies between the dermis of the skin and the underlying muscle. This layer is composed primarily of adipose tissue, connective tissue, blood vessels, lymphatic vessels, and nerves. The subcutaneous route is especially useful when a drug requires slow, sustained, and predictable absorption rather than the rapid absorption seen with intravenous administration. Anatomy of the subcutaneous tissue. To understand the pharmacology of this route, it is important to know the structure of the skin. First is epidermis, second is dermis, third is subcutaneous tissue. First is epidermis, the outermost protective layer that contains keratinase cells and acts as a barrier. Second is dermis, a highly vascular layer containing blood vessels, sweat glands, hair follicle, and sensory receptor. Third is subcutaneous tissue, adipose tissue, loose connective tissue, small blood vessels, lymphatic capillaries. Principle of the subcutaneous drug administer. The principle of the subcutaneous administer is based on absorption by diffusion through capillaries and lymphatic vessels. When a drug is injected into the subcutaneous tissue, does not enter the blood immediately. First is drug deposition, second is drug dissolution, third is diffusion, fourth is systemic absorption. First is drug deposition. The medication is deposited in the extracellular fluid of the subcutaneous tissue. Second is the drug dissolution. The drug dissolves in the interstitial fluid surrounding the tissue. Third is diffusion. Drug molecules move from an area of higher contraction at the injection site to an area of lower contraction in nearby blood vessels. Four is systemic absorption. Blood capillaries and lymphatic vessels. Pharmacokinetics of subcutaneous administer. For absorption is the most important pharmacokinetic process in SC administer. Characteristic: slower than intravenous, slower than intramuscular, faster than oral administer in many cases. Example: insulin injected subcutaneous begin acting approximately rapid acting insulin 10 to 30 minutes, regular insulin 30 to 60 minutes. Distribution. After entering the bloodstream, the drug is distributed according to blood flow, tissue permeability, plasma protein binding, and lipid solubility. Metabolism and elimination. Once absorbed, the drug undergoes hepatic metabolism and renal excretion. Factor affecting absorption. Several factors influence how quickly a drug is absorbed from the subcutaneous tissue. First is blood flow. Blood flow is the most important determinant. Increased blood flow, heat, exercise, and massage result faster absorption. Decreased blood flow, shock, hypothermia, vasoconstriction result slower absorption. Second is drug formulation. Aqueous solution absorbs rapidly because the drug is already dissolved. Suspension absorption slowly because particles must dissolve before absorption. Example: long acting insulin preparation. Third is molecular size. Small molecules diffuse easily through capillary walls. Large protein and biologic drug often enter circulation through the lymphatic system, resulting in slower absorption. Fourth is the local temperature. Higher temperature causes vasodilation. Vasodilation increases blood flow and accelerates absorption. Cold temperatures causes vasocontraction and slow absorption. 5 is injection site. Absorption rate differ among body regions. This is why insulin is frequently injected into the abdomen. Advantage of the subcutaneous route. First is avoided first pass metabolism. The drug is not exposed to hepatic first pass metabolism before reaching systemic circulation. Second is suitable for peptide drugs. Protein such as insulin would be destroyed in the gastrointestinal tract is taken orally. Third is sustained drug action. Slow absorption provided prolonged therapeutic effect. Fourth is self-administered. Patient can easily administer drugs themselves at slow. 5 is better patient completion, less invasive and less painful than many intramuscular injection. Disadvantage. First is limited volume, usually only 0.5 to 2 ml can be injected safely. Second is slow onset, not suitable for emergency, required immediately drug action. Third is variable absorption, blood flow, temperature, physical activity. Fourth is local adverse effect, pain, infection, bruising, edema, lipodystrophy. Clinical application. First is insulin heparin monoclonal antibody. First is insulin. Used in diabetes mellitus because insulin is destroyed if administered orally. Second is heparin. Provide anticoagulant effect with predictable absorption. Third is monoclonal antibody. Many biological drugs for autoimmune disease and administer subcutaneous. Okay, thank you.